Unsettling news out of Louisiana this weekend as medical experts trace the progression of bird flu in animals and humans. As Tom Jensen reports, testing there showed samples taken from an elderly patient with the H5N1 virus suggests the virus is mutating and might more easily infect humans.
Federal health officials released the latest news about the Louisiana patient headed into the weekend, theorizing that the new mutations might help the bird flu virus H5N1 infect humans more easily.
And that sequence showed that it actually is binding quite well to receptors in the upper airway in this particular Louisiana patient.
The news of new mutations is also getting the attention of consumers who know this isn't just about egg prices anymore.
We've been nervous about it, but I don't know enough about it.
It's pretty nerve-wracking. We just don't know what's going to happen. So, yeah, just kind of waiting what's next to do for us to do. Yeah.
Bay Area epidemiology expert Dr. George Rutherford says if it gets to this point, the U.S. is better prepared to fight bird flu than they were for COVID because labs here have been developing H5N1 vaccines since the 1990s.
There are 400,000 vaccines in the federal vaccine stockpile that could be used for if there starts to be evidence of transmission, would probably give it to dairy workers and their contacts and people who work with poultry and their contacts.
There have been more than 60 reported human cases in the U.S. 38 have been in California, and all but one were infected by dairy cows or poultry. And state health leaders say one source is unknown.
Human-human transmission is what is required for a pandemic. We don't have it yet. We have to watch, though. And of course, we have real concern about that. And that's why we need to track this and regulate this very closely.